and the touch skills. How did we figure out the right way to touch, in the right place to touch, and at the right time to touch? A lot of the touch skills actually came from dads because they get the brunt of the woman's anger if they touch her in the wrong place, the wrong time, in the wrong way during the birth. So dads really wanted to know how to touch. And touch is a communication skill. And that is one of the things that we learn. If you go back to the communication video, you'll understand that communication is both verbal and nonverbal, both to ourselves and to other people. And touch is a form of nonverbal communication. Those of you who know the Pink Kit, and Jeannie had a copy of the Pink Kit, it was body work. And the body work was developed in the 1980s. The breath, language, and communication skills, along with many of the soft skills, were developed in the 1970s. Because in the 1970s, there was a 5% cesarean rate. 95% of women labored because anything that could happen or might happen was considered to be acceptable. The medical profession wasn't sophisticated enough, and childbirth was just considered to be normal, natural, and physiological. And that meant with all of its complexities. So when we were looking at touch, we're looking at touch to convey to the woman, one is comfort, she wants to be comforted, and two is for her to remember to use her skills to open up inside her body in order to reduce the tensions that we talked about in another video. The touch skills came from men after being snapped at by women in birth. They want to help women, but women don't often like to be touched in birth. And often if they do like to be touched, they want to be touched in exactly the right way, at the right time, and in the right place. So we had to take that into consideration. The body skills that developed in the 1980s, which were known as the Pink Kit, has in it the pelvic clock exercise, which is basically to soften the connective tissue inside the pelvic clock. For you who are chiropractors, you may know where the pelvic clock is, and for you who are just ordinary people like me, you might not. So where is the pelvic clock? First of all, the cervix is in the middle of it. So that's like a clock face with where the hands meet in the middle is the cervix. Sometimes you hear people say, well, for the cervix to dilate, it pulls up. No, it doesn't. It is retracted outward into the bones of your pelvis. It's pulled open by the contractions. And the top of your vagina is the pelvic clock with the cervix in the middle. We can't feel all of where it's attached. Nobody can. We can just really feel where the front of it is attached into the middle part of our pubic bone. But it continues its attachment from the middle part of our pubic bone to the area of the pelvis that's above where the leg bone meets the hip sockets. And then it continues into the middle of the sacrum. That's where the top of the vagina is, with the cervix in the middle. For the baby to come out of our uterus, that cervix has to be retracted back into all of that space. So there's just a big gaping hole there. And that big gaping hole is the inside of the uterus, because the cervix is part of the uterus. And when the baby comes out, it's coming out of the cervix that has opened up big enough so that it can move out of the uterus. And then after the baby moves out of the uterus, fully out of the uterus and out of the birth canal, then the cervix closes back down again. And the placenta is often inside the uterus, attached to the cord, attached to the baby. And then there are contractions in which the cervix opens up again, but to a smaller level, and the placenta then falls into the birth canal and comes out of the birth canal. So where the top of your vagina is attached to your inside of your bony structure, where your leg bone meets your pelvis above that, and the sort of the middle part of your sacrum, that's the pelvic clock. When you use Birthing Better breathing skills and expand with your inhale, you are expanding the ability of the bony structure to have a slight mobility. You'll feel it much more in the sacrum, and much more in the back of the hip bones where the sacrum meets and the hip bones. That's how the pelvis opens, because it is the sacrum that has the most mobility. So when you inhale and expand into your pelvis, your lungs are not dropping down into your pelvis. It's just much deeper than belly breathing. It's breathing into your pelvis and intentionally expanding it with your inhale. That is opening up the pelvic clock. But when you exhale, you can then soften the soft tissue inside and where the top of your vagina attaches to the inside of the pelvis. And you do that through communication. We initially did it through words. Soften inside your right hip. Soften inside your sacrum. Soften inside your left hip. Soften inside your pubic bone and lower belly. Now, as you noticed, I'd had an extended pause between each direction. That's because I'm doing it in my body. And that's what we found. Mothers and fathers work together. We have the same body, and we have to do it because then we know when we've done it sufficiently enough to move on to the next space. Because initially, if it did this, soften in your right hip, soften in your sacrum, soften in your left hip, soften in your pubic bone and lower belly, women couldn't do it. Men couldn't do it. We can't do it because we're not giving our body, our soft tissue, our fascia, our connective tissue, time to respond to the command in our head. So when we breathe in, expand that area, and when we breathe out, we can mentally soften in different points on the inside of that pelvic clock. And that's a bit different than being specific to saying soften inside your right hip. And what does this have to do with touch? Well, we found, as people who were helping women birth, that saying those words for extended periods of time, over hours, was exhausting. So we developed the touch skills. So we had to develop the touch skills to the right place. So for example, having a woman relax her shoulders was not as impactful as being able to touch her right hip. And if you'd practice together, then the woman would soften under your touch. And then that comes to the right place, but then it's the right time. When do you do that? And that's where the communication skills come in. Sometimes it's between contractions. Sometimes it's during a contraction. Well, during a contraction, does that mean at the beginning of it? Or is the intensity rising up? Or during the peak? Or as it's going down? Or as it's stopping? That's where communication is helpful when you're working together, because it depends on the individual woman. Can you do this when a woman's having a cesarean? Not by touch, because there's fabric that stops you from seeing that. However, you can whisper in her ear to just soften inside your pelvis. And even though she's been numbed, she'll still do that. So if we have the right place, the right hip, and then we pause and put our hand on the sacrum, and we pause, and then we do it for the left hip and pause, or the pubic bone and the sacrum, or the two hips together. That is communication using touch, and we found it was less tiring. So we had the right place, finding the right time, and the right way to touch. That became something we had to work with. There are layers in our body. Your skin's a form of connective tissue. Your muscles are, your ligaments, your tendons are, and they're all attached together. But if you put your hand on your leg at your skin level, can you contract your skin without contracting anything else? No. What if you have fat underneath it? Can you contract that? No. If you go down to the muscle in your thigh, can you contract that? Yes, you can. If you go down to the bone in your thigh, can you contract your bone? No. So if you put pressure on your thigh, just rub your hands on your thigh and put deep pressure with your hands and then pop that pressure up. Were you able to relax as you did that? Not likely. But if you put your hands on your thighs and then you put deep pressure down and you pause, and then you slowly, 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 slowly let up on that pressure and you intentionally soften at each stage, then that's the right pressure. However, we discovered that women didn't like it when you went deep down. So we discovered that you practice this beforehand and that in birth you just put your hand onto the body because you've learned the skill together. And as soon as you touch the right place at the right time, the woman then will soften under your touch.